Hello, I'm Olivia and I'm here for my first skin check. With me I have Dr. Amy Waltoff, and she's going to answer a couple questions for someone like myself who's never done this before. So my first question is, what age should someone start getting a skin check?
So really, I have some patients that their parents have had things taken off. They've got a family history of melanoma, they've had abnormal moles since childhood, and that can really start as a baby. You know, you can have congenital nevi that you want to watch for changes. If mom, dad, or a first-degree relative have melanoma, even toddlers, it's a low percentage, but if there's funny moles, it's never too early to start getting skin checks.
Is there anything I should be doing before I come in for my skin check?
Before you come in, what we like to do is, because you're going to have, the doctor's going to ask no matter who it is, have you noticed anything new, anything changing, anything bleeding, anything not healing? So it might be good just to take an overall survey of yourself and say, that actually is something I just noticed, or this one looks a little darker, so that when they ask that, you're not kind of caught off guard, and then you leave and you think, oh man, I should have asked about that one, or I should have told them that this one has gotten a little bit bigger. So I just say kind of take a look, and a lot of patients will have their spouses or family members circle things that they're not able to see as well if they see something that's kind of dark on the back, on the scalp. Hairdressers a lot of times can even tell you if there's something they've noticed that might be changing. And so just kind of an overall survey of yourself so that you don't leave here thinking, I should have asked about these things, and just noticing anything that either looks funny. Even if we say it's fine, it's better to bring it to our attention so that your question's answered. And then if we say, you might need to keep up with that or check on that, something we're going to be monitoring, you know exactly which one it is and what it looks like, and have an idea of the overall look of your skin before coming in.
So what do you look for when we actually do the skin check?
So we usually start, and everyone has their own method, but I like to kind of go head to toe and just look for any dark moles, dark spots, red spots, anything with a scab on it. And so as I'm going, I usually ask questions. Has this been here a long time, or since childhood? Have you noticed any changes? Has anyone in your family noticed any changes? If I see a scratch, a lot of times people have puppies, or they do gardening and they get scratches. Has it been longer than a month? Because everything should heal on the skin usually within a month. And so I just kind of go along and look for anything that's a little out of the ordinary, ask questions about it, and then we kind of decide from there, does it need to be sampled or is it something we can watch?
How often should I get a skin exam?
So what we normally recommend is, depending on family history, we'll kind of determine initially how often you get a skin exam. So anyone who's had a first-degree relative with a melanoma, we recommend without a doubt once a year, even if you don't have anything to look at, because you're automatically at a little bit of an increased risk. Other than that, if you don't have a whole lot of moles, the dermatologist may say 12 to 24 months before you need that.
What actually happens during a skin check?
So during a skin check, what we do is have you remove, the majority of your clothing or whatever you're comfortable with. Some patients leave on their undergarments, bras and panties, and we can check under there if there is something that they're worried about. Some patients take everything off and have us check everywhere. Anything that we can see with the eye, we're happy to check. Things can pop up anywhere, and one of the biggest myths is that skin cancers only happen in sun-exposed areas, but they can actually happen in certain types in areas that have never seen the sun. And so it's something that, oftentimes if patients have something in the genital area, we'll ask, is there anything under the underwear, and so we can look there. Or women a lot of times have regular OB-GYN appointments, and they can keep an eye on it as well.
Thank you for answering my questions. I really appreciate you meeting with me today.
You're welcome. Happy to do it.
Great. What's the best way for someone to make an appointment with you?
So at our office, you can call anytime to schedule an appointment. Our number here is 214-420-7070. And our schedulers are great. You get to talk to someone in person, and they can look to see when's the next most convenient available appointment.
So don't forget to schedule an appointment with Dr. Waltoff.